Hi, this is Joel again, and there's still some confusion as to how the revolutionary features of the AnyRide works. So what I'm going to do is I'm going to narrate this short 30-second video, but I'm going to pause it to kind of go over the different highlights and really show the different features of the unique design. So let me start right here. You can clearly see, first of all, that the tapered implant design of the core, which is a 3.3 core, again 3.3 and 4.8, those are your two main core sizes. Your 3.3 core is relative to your 4.0, 4.5, 5.0 and 5.5 implant. Your 4.8 core is relative to your 6.0, 6.5, 7.0, 7.5 and 8.0 implant. But again, notice the core. So that means because you have a small 3.3 core, and by the way, 90% of what you'll use is within your 4.0 through 5.5 implant sizes. Because you have a small 3.3 core, that means you remove a minimal amount of bone, as you can clearly see here. Okay, because as with other implant systems, the bigger the implant, the bigger the osteotomy, which again removes viable living tissue, which you really need in the area to get a great aesthetic result. All right, so a couple other features to note. Look at the round apical portion of the implant. Okay, this is the domed portion of the implant, which is very key, especially when you're close to the sinus lift area. Note or rather when you're doing sinus lifts, note that the features of the knife edge threads here. So it starts here and it sort of flutes out. If you want to think about something relative to this, you can think about how a corkscrew works. Okay, think about how a corkscrew works. It's very, very similar design. And that way the corkscrew design of the threads, if you will, drag the implant very seamlessly and effortlessly down into the bone itself, as you'll see in just a second. Here's your handpiece adapter. This is the reason this is a black mark is because ideally, again, when you're placing the implant, this is the level of the bone where you'll place it at right there. So this is your 1 millimeter mark, 2, 3, 4, and 5. So when you're placing the implant, you actually count backwards because obviously it's difficult to see with the tissue and so forth. You count backwards to see where you are. So you're going to count 5, 4, 3, 2, 1. Because the implant's going to be in the bone and you want to be right here at that black mark, right to the crest of the bone. Another thing to note, this hex portion here, you see this hex portion here, this is relative to the internal portion of the internal hex of the implant. So all these things are to aid you in your implant placement. That way you don't have to remove your handpiece adapter and visually verify. Everything is here for you. All right, so now let's note how the implant goes into place. All right, so there's the implant. And it's going up slowly at about a 25 to 30 RPM. Now I'm going to stop you right here again, and let's look at the type of bone that we're in. And you're 25 to 30 RPM, and you're going to set your motor at 40 Newton centimeters. And again, 40 Newton centimeters is the key, because what you want to do is have the bone tell you and if the implant can be placed in that density of bone. Okay, because again, you have your cortical plate up here and you have your trabeculae bone underneath here. So relative to how you're placing your implant, again, the bone will dictate to you what's possible and what's not possible versus you trying to force it into place. Okay, and again, these ratchet adapters and handpiece adapters are designed to strip at about 100 Newton centimeters, about 80 to 100 Newton centimeters. So that tells you something as well. All right, let's continue. All right, so there's your implant going nicely into place. Notice how the threads are literally, the knife edge threads are just engaging the bone all the way up. Now let's stop that right there and pause it. Again, notice that little gap right here and your domed area there. That's relative to the drill design, as well as, okay, here is, again, let me show the outline, your tapered portion. Note where the thread, outer portion of the thread is out here. So that is your final diameter of the implant, not your core. Your core is only the body of the implant. Your final diameter of the implant is out here. Again, your final diameter, as an example, is 4.0, 4.5, 5.0, or 5.5 relative to the 3.3 core. All right, let's go just a little bit further. And there we go right there. So that's all the way to place. Note your black mark on your handpiece. This is 1 millimeter mark. So this will tell you how deep you want to place your implant. Can you leave the implant, however, at a bone level? Absolutely you can. Okay. However, this implant system is designed to place the implant 1 millimeter subcrestal to the bone. Note here is, as just a quick prosthetic note, here's your CEJ, if you will, of the tooth, of the molar, and here's your CEJ of your, what is that? Is that a bicuspid area? Yep. Okay. So what you want to do is, prosthetically speaking, to make your life easier prosthetically, you want to have this implant placement at least 2 millimeters below the adjacent teeth CEJ. So you want to be cognizant of that as well when you're placing the implant. Now let's go just a little bit further. And again, note here's your hex, and there's your hex there. Again, so everything aligns. All these handpiece adapters and ratchet adapters are for your benefit to use in implant placement. All right, now let's see if I can stop this in time before it. There we go, almost. There we go, right there. This is what I want to show you. Note all the different blocks of bone, I'll call it. Look at how the knife edge thread really engages the bone, and all that bone adds to the stability of the implant. This is why you want to set your motor at 40 Newton centimeters to be able to have the bone tell you what it's going to withstand and what it's not going to withstand. All right. So I hope this short video has helped you understand the advantages of the AnyRide implant when it comes to the placement of the implant itself. Thank you very much, and we'll talk to you guys soon.